Breathing is so natural, so automatic that we often take it for granted. We rarely stop to think about the intricate processes that make this simple act possible. Each inhale and exhale is like a note in a beautiful symphony, a testament to the incredible orchestra within our bodies. This symphony plays continuously day and night without us even being aware of it most of the time. This constant flow of air sustains us, providing oxygen to our cells and removing waste products. It's a delicate balance that our bodies manage with remarkable precision. But what happens when the music changes? When the rhythm of our breath is disrupted, it can be a sign that something is wrong. Just as a discordant note can disrupt a harmonious melody, unusual breathing sounds can signal an underlying health issue. These sounds are like the body's way of telling us that it needs attention. These sounds, ranging from subtle wheezes to alarming gasps, serve as important clues, alerting us that something may be amiss. They are the body's SOS signals, urging us to take action. While not all breathing irregularities warrant immediate medical attention, learning to recognize these sounds can empower you to seek help when necessary. It's about being in tune with your body's needs. Think of it this way: your body is constantly communicating with you, and unusual breathing sounds are one way it tries to get your attention. It's a conversation that could be crucial for your health. Ignoring these signals could have serious consequences, while early detection and intervention can often make all the difference. By listening to your body's symphony, you can ensure it continues to play beautifully. Knowing the difference between normal and abnormal breathing sounds can be life-saving. It allows for early detection of potential respiratory issues, which can be crucial in preventing more serious health complications. While occasional sighs or yawns are perfectly normal, persistent or sudden changes in your breathing pattern warrant attention. These changes can be subtle or quite noticeable, but either way, they should not be ignored. These changes may manifest as different sounds, each providing clues about the potential underlying cause. Understanding these sounds can help in identifying whether the issue is minor or requires immediate medical intervention. Some of the most common abnormal breathing sounds include wheezing, stridor, and crackles. Each of these sounds is associated with different conditions and can guide healthcare professionals in their diagnosis. Wheezing often presents as a high-pitched whistling sound, typically heard during exhalation. It is commonly associated with asthma, bronchitis, and other respiratory conditions. Stridor, on the other hand, is a harsh, high-pitched sound produced when breathing in, often signaling a blockage in the upper airway. This can be a sign of a serious condition that needs prompt medical attention. Crackles, as the name suggests, resemble the sound of crackling paper and can indicate fluid in the lungs. This sound is often associated with conditions like pneumonia or heart failure. Recognizing these sounds is the first step towards addressing the underlying issue. Early detection and intervention can significantly improve outcomes. By familiarizing yourself with these auditory cues, you become an active participant in your own health journey. This knowledge empowers you to seek timely medical advice and take better care of your respiratory health. Wheezing is a common breathing sound that often manifests as a high-pitched whistling sound, primarily heard during exhalation. This sound occurs when air is forced through narrowed airways, much like the sound produced when blowing air through a straw with a pinched end. Several factors can contribute to wheezing, ranging from relatively benign conditions like asthma to more serious issues like chronic obstructive pulmonary disease or COPD. Asthma, a chronic inflammatory disease affecting the airways, commonly causes wheezing, especially during an asthma attack. In addition to asthma and COPD, other potential causes of wheezing include allergies, respiratory infections, and even heart failure. Understanding the potential causes of wheezing allows healthcare professionals to make an accurate diagnosis and recommend appropriate treatment. Stridor is a harsh, high-pitched sound produced when breathing in, often signaling a blockage in the upper airway. This sound can be alarming and is usually a sign that something is obstructing the normal flow of air. Imagine the sound of air struggling to pass through a partially obstructed pipe. That's stridor. It can be quite distressing to hear, especially in young children. Unlike wheezing, which is primarily heard during exhalation, stridor is most noticeable during inhalation. This distinction is important for diagnosing the underlying cause. The causes of stridor can vary widely, from relatively harmless conditions like croup, which is a common viral infection in children that causes swelling around the vocal cords, to more serious issues like a foreign object lodged in the throat, which can be life-threatening if not promptly addressed. In such cases, immediate medical intervention is crucial to remove the obstruction and restore normal breathing. In infants and young children, stridor can sometimes be a sign of epiglottitis, a potentially life-threatening infection that causes swelling of the epiglottis, a flap of tissue that covers the windpipe. This swelling can rapidly block the airway, making it difficult to breathe. Due to the potential severity of the underlying causes, stridor should always be taken seriously, especially in young children. If you or someone you know experiences stridor, seek immediate medical attention. Early diagnosis and treatment can prevent complications and ensure the best possible outcome. Remember, stridor is a medical emergency, and timely intervention can be life-saving. Section 5. Crackles fine or coarse? Crackles, also known as rails, are abnormal breathing sounds that resemble the sound of crackling paper or Velcro being pulled apart. These sounds occur when air passes through fluid-filled airways, much like the sound produced when walking on fresh snow. Crackles can be further categorized as fine or coarse. Fine crackles are high-pitched, brief, and often described as sounding like hair being rubbed between fingers. Coarse crackles, on the other hand, are lower in pitch, longer in duration, and may sound like bubbling or gurgling. The presence of crackles often indicates fluid in the lungs, which can be caused by various conditions including pneumonia, heart failure, and pulmonary edema. The type of crackles, whether fine or coarse, can provide clues about the underlying cause and guide treatment decisions. Section 6. Other sounds of concern. While wheezing, stridor, and crackles are among the most common abnormal breathing sounds, other sounds can also indicate underlying respiratory issues. These include raunchy, low-pitched continuous sounds that resemble snoring or rumbling, often caused by mucus in the larger airways. Pleural rub. A grating or squeaking sound that occurs when the inflamed surfaces of the pleura, the membranes surrounding the lungs, rub together. Gasping. Sudden, short inhalations of air, often a sign of respiratory distress. Recognizing these less common sounds can be challenging, but is crucial for timely intervention. If you notice any unusual breathing sounds, especially if accompanied by other symptoms like shortness of breath, chest pain, or fever, seek immediate medical attention. Section 7. When to seek urgent help. While not all breathing irregularities warrant immediate medical attention, some situations demand prompt action. If you experience any of the following, seek urgent medical help. Sudden onset of shortness of breath or difficulty breathing, stridor, especially in children. Bluish discoloration of the lips or fingertips, cyanosis. Chest pain accompanied by breathing difficulties. High fever with breathing problems. Inability to speak in complete sentences due to shortness of breath. Remember, it's always better to err on the side of caution when it comes to breathing difficulties. Section 8. Listen to your body, breathe easy. Breathing is fundamental to life, and any disruption to this vital function should never be ignored. By familiarizing yourself with common, abnormal breathing sounds, you empower yourself to recognize potential problems early on. Remember, early detection and intervention are key to breathing easy and living a healthier life. Don't hesitate to seek medical attention if you notice any unusual breathing sounds, especially if accompanied by other concerning symptoms. Your health is your most valuable asset, so listen to your body and breathe easy, knowing you're taking charge of your well-being.